Bertha Henry has served as the Broward County Administrator since October 2008. As County Administrator, she serves as Chief Executive Officer of Broward County and directs the functions of county government, which fall under the leadership of the Board of County Commissioners. Ms. Henry oversees a county of nearly 1.9 million residents and operations for nearly 60 agencies with more than 6,200 employees, including the airport, seaport, and Greater Fort Lauderdale Convention and Visitors Bureau.
I was born in the 50s. I monitored the tumultuous 60s from afar. I attended Florida State University in the early 70s. I recognized early on that if you want to see change and you want to make change, you have to be part of it. So I chose government, and I continue to be inspired by the changes that I see we're making every day.
Ms. Henry has a Master of Science degree in Public Administration and a Bachelor of Science in Government from Florida State University. Ms. Henry has received numerous awards and recognitions for her professional and volunteer endeavors and is affiliated with a number of organizations. A native of Miami, Florida, Ms. Henry has a distinguished career in public service with more than 35 years of experience in public administration. She first came to Broward County in 1996 and served as assistant to the county administrator until 1998, when she accepted a position as assistant city manager of finance and administration for the city of Miami, assisting with the city's financial recovery plan. She returned to Broward County in July 2000, serving as Broward County's deputy county administrator.
I'm really honored to be chosen as a trailblazer, even though I don't always consider myself as a trailblazer. I work with wonderful people day in and day out who are very committed to making this county the best county that it can be. And so when I can accept an award, I'm accepting it on behalf of all of these wonderful people. So I thank the committee for the honor of the selection.
Jorge Hernandez was named Commercial Vice President, Southeast Region for Quest Diagnostics in July 2015. He is responsible for all sales, marketing, and new business development in that region. In this capacity, George oversees a team of over 150 business professionals. He is responsible for one of the larger and more successful businesses in the state, with nearly 20 million patient encounters per year. Prior to joining Quest, George gained more than 20 years of sales and management experience at Bristol Myers Squibb Incorporated and Johnson & Johnson.
My inspiration came at an early age from my parents. I was good in the sciences, and they inspired me to go into healthcare. Honestly, if it was up to my mom and dad, I probably would have been a physician. However, I chose the pharmaceutical sciences because that allowed me to impact the lives of more people. More recently, I've been working with Quest Diagnostics in the laboratory industry, and I've been inspired by Dr. Paul Brown, who is the founder. And I've learned from having met him personally. He is now retired, but I've met him personally, and I found that he had the same type of inspiration that I had as a young child.
A native of Cuba, George came to the U.S. in 1968 and grew up in northern New Jersey. George earned a Bachelor of Science degree in pharmacy from the College of Pharmacy at Rutgers, the State University of New Jersey, and an MBA from the Lubin Graduate School of Business at Pace University in New York City, graduating both with high honors. George is a registered pharmacist in Florida and New Jersey. Mr. Hernandez has served on both the Pharmacy Council of the College of Pharmacy and the Board of Trustees of Rutgers, the State University of Jersey. He has received numerous President's Clubs awards and over his distinguished career, including 4 times while at Quest Diagnostics.
Being selected as a trailblazer in health, that is such a deep honor. I believe that we don't do what we do focusing on personal accolades. I believe that we do it focusing on others and the difference we can make in their communities. An award like this is a surprise. However, if I've made a difference in other people's lives, then I'm happy.
Representative Shevrin D. Jones, Florida House District 101, was elected to the Florida House of Representatives in 2012 and has since been re-elected unopposed. Beyond his duties as an elected official, Representative Jones works at City Year Miami as the Director of Major Gifts and Strategic Partnerships. Additionally, he is the founder and CEO of LEAD Nation, one of South Florida's top youth organizations for leadership development training. Representative Jones attended Florida A&M University, where he received his Bachelor of Science degree in biochemistry. Currently, he is attending Florida Atlantic University, where he is pursuing his doctoral degree in educational leadership, higher education.
The thing that inspired me on this career path is an old saying that says that if you're not at the table, then you're on the menu. And I wanted to have a seat at the table because there were things that I saw within my community that I did not agree with, that I did not like. And my parents raised my brothers and I to know that if you're going to complain about it, you should do something about it. So pulling up a seat at the table allowed me that opportunity to be that change agent. What motivates me to continue on this career path is to see and witness the change that happens on a daily basis, whether it's in my district or whether it's with the 20 million people who lives in the state of Florida.
Representative Jones is also very involved locally, statewide, and nationally. He is a member of the Alpha Phi Alpha Fraternity Incorporated, the South Florida Youth Summit's Executive Planning Team, and the Council of State Governments Tolls Fellowship Program. He has been recognized with numerous awards and accolades. Representative Jones is committed to working with others, reaching across the aisle to do the work of people in his district and for the state of Florida. He has been able to put politics aside and pass meaningful legislation even while being a member of the minority party. Some of Jones' bipartisan legislation includes safety and oversight for athletic coaches for youth athletic teams, police body cameras, and advocating and procuring funding for the youth mentoring programs.
To be chosen as a trailblazer in health, first, I'm humbled and honored for the opportunity to be chosen. And it's important that people understand that healthcare is a right. Because if you have healthy families, you have a healthy community. And it's important that each elected official understands that we cannot and we should not politicize health. It's something that we all should be advocating for to ensure the safety of our communities.
Chris Paterson is the Chief Executive Officer of Sunshine Health, one of the largest comprehensive healthcare plans in Florida. Sunshine Health, a subsidiary of Centene Corporation, offers Medicaid, long-term care, Medicare, health insurance marketplace products, healthy kids coverage, and a child welfare specialty plan.
I was inspired early in my career as a young professional, as an assistant professor at the University of Miami, when I got to experience the excitement of providing health care in the community and teaching young people about providing healthcare services in the community. And that led me to enthusiasm about building high-performing teams of people who can develop systems of care to serve underserved communities. And that is what keeps me excited and keeps me coming to work every day.
Chris received undergraduate, master's, and doctorate degrees from Ohio State University. Throughout his career in both public and private companies, Chris has been made responsible for all aspects of operations, strategic planning, and the introduction of innovative care management models and programs. He is the chairman of the Florida Association of Health Plans and the Urban League of Broward County. Mr. Paterson is also a member of the Orange Bowl Committee and sits on the Board of Advisors for Florida International University's Center for Leadership. He is also a member of the Florida Health Insurance Advisory Board and the board of the Florida HMO Consumer Assistance Plan.
It means a lot to me to be selected by Broward Community and Family Health Centers, knowing the other folks who have received it in the past. But I would be remiss if I did not say that this award belongs to the 2,000 employees of Sunshine Health who every day touch our members, call our providers, serve our customers to make sure people are getting the quality health care that they deserve.
Dr. Elaine M. Wallace currently serves as the Dean at Nova Southeastern University College of Osteopathic Medicine. Dr. Wallace holds the rank of professor in the Department of Osteopathic Principles and Practice in Sports Medicine. She is also the residency director of the NSU COM Sports Medicine Fellowship. Dr. Wallace has a BS in biology. She has a MS in higher education, teaching and leadership specialization, and a MS in criminal justice, behavioral sciences specialization, and a MS in brain research. She is currently enrolled in the Masters in Management and Administration of Educational Programs. Dr. Wallace is certified in family medicine, sports medicine, and neuromusculoskeletal medicine.
I have always felt that my career path was chosen for me. I was wanting to be a physician at the age of 6. No one in my family is a physician. In fact, no one had even graduated from college at that time. So I have felt that it is a job, it is an assignment given to me by God, and I feel as if I will be a physician and a healer for the entirety of my life. What inspires me to continue in this job is evidenced by what we're doing here today. I am very honored to be receiving the award as a trailblazer in healthcare.
Dr. Wallace is a recognized national and international lecturer. She has received Teacher of the Year awards 11 times during her medical school teaching career and has received 4 awards in Who's Who among American teachers. Dr. Wallace has made a significant contribution to the body of knowledge in her subspecialty, developing a totally new diagnostic and treatment modality known as torque unwinding, which has been taught to students and physicians both nationally and internationally. Dr. Wallace was one of the pioneers in the development of medical missions for the osteopathic profession. Dr. Wallace has been influential in the humanistic development of medicine. She held a Templeton Society grant that allowed her to develop courses in spirituality and medicine, now taught at 2 medical schools and to physicians nationwide. She has led missions to Mexico, Guatemala, Ecuador, Vietnam, and currently to Bangladesh. In addition, Dr. Wallace pioneered development of standard patient training for medical students 27 years ago that has now become standard of education and testing in osteopathic profession.
It's an extreme honor to be chosen as a trailblazer in health, and I really appreciate the thoughtfulness of that award. However, in this country at this time, we should not be recognizing people that care for the underserved as award winners. We should be in a country where the wealthy and the underserved all receive adequate health care without awards given.
You're broken down and tired.
One of my legacies is my children. My wife Nicole and I have 4 great kids, the first 2 of whom have already chosen healthcare as a profession. I have a physician and a therapist to be, and I'm hoping those 4 can go on to leave their mark in helping others.
I would like to be remembered as the daughter of Roland and Essie Watson, the eldest of their 8 children, who was able to take all of the love, the support that I was given as a child and turn it into something that could make them very proud.
The legacy that I would like to leave behind is my love for my family, my love for my community, and my passion for people.
I think I would like to leave behind 2 legacies. The first is something I don't want to be remembered for, and I do not want in the future to be remembered for being a woman in medicine. I grew up in a time where I was one of 10 women with 165 men, and I did have to face discrimination as being a woman in medicine. I hope that I have been a trailblazer in that fashion, in setting the road for the women behind me to have an easier road to become physicians.
This is a community that is diverse. It is representative of what America really should be about, and I'm hoping that our community continues to be a beacon for the rest of the United States and quite frankly the world.
When I look back over my career, what I would like to be remembered for the most is the hundreds of people whose lives I have touched and how we have worked on influencing them to make a difference and to focus on what matters.
I would like to be remembered for the fact that I fought for every last one of those things. And even if I never run for office again, I want people to know that I will continue to fight for those very things.
I would like to be remembered for excellence, because what I have learned across my journey is that when you are excellent, it is difficult to discriminate against you. So I hope all of my students will seek excellence, excellence in their education and excellence in their patient care.
I hope people remember me as someone who was fair and ethical and helped to build great, diverse teams of people who built systems of care in the community that made a difference.
I have what I like to call the 3 H's, which are 3 words that define what you need to do to be successful: hunger, humor, and humility. And as long as you have those 3 attributes, you can do wonderful things no matter what you do in life.
I'll rise up, rise like the day. I'll rise up in spite of the ache. I will rise 1,000 times.